Okay, just had a little bit of time. I wanted to play the piano. I'm Tin, one of the radiology chief residents.
And I'm Tyler, one of the other radiology chief residents.
And I'm Hetty, and I'm also a radiology chief resident.
So since you guys can't be here in person for us to show you around, we thought that we would give you a video tour of our sections. The first one we'll start with is the breast imaging section. So right now we're standing, you can see the front and the back. This is our main atrium. We're at the Smilo North Pavilion Cancer Center Tower,
Which is one of the newest buildings here on the Yale campus. It's where we do all our oncology, imaging, and clinical services.
So come on, let's show you around. So now we're in the main breast imaging center.
So as a patient, you'll come in here. This is where the patients will wait while they're waiting for their imaging.
So down here we have, so within the imaging core itself, we have 2 hologic tomosynthesis units, and we have 3 ultrasound units itself. Down here we've got 1 of the mammography units. Here we currently have a biopsy undergoing. If we go around to the other side, and here we have another mammography room. We've got another ultrasound room here, ultrasound room there, as well as here and here. And if you want to come on down to the end,
Biopsy room, where you do all your procedures that are mammography guided.
And then here we have a dedicated breast MRI. We won't go in there right now. I think they're scanning the patient as well. All right, now we're going to head into the reading room itself. We'll meet some of our trainees, some of the attendings, and we'll say hi to the techs as well. All right, so let's stop over here first.
Hey, Casey.
This is Casey, one of our former residents, now current breast imaging fellow.
Yeah, so I'm one of the current fellows here. Today I'm doing MRI, which we do around 5 to 10 of these a day. A lot of them are high-risk screening. We have a very wide or large referral program, and so it's a very busy center here.
What made you want to stay here as a fellow, as you're a resident?
Yeah, so I was a resident here. Obviously, I enjoyed my time. The faculty is great. They're world-renowned. They often give lectures throughout the nation on a fairly regular basis, and learning from the best is a big reason of staying here.
And what are your plans for next year?
Next year, I'm actually going to work at a private practice in Montana. Yeah, in Billings.
Awesome.
Yeah.
Is mammo going to be a big portion of that?
It is, yeah. It's going to be about 50 to 75%, and then the rest will be general radiology.
Wonderful. Cool. Well, thank you. I'll let you get back to it.
Thanks, Casey.
All right. So here we have Mike, one of our other residents.
Hello. Hey guys.
Hey, Mike.
How's it going?
Welcome. So I am currently doing procedures this week, and so we had a wire localization that we did earlier today. Just got the specimen back, and it looks good.
Nice.
Things are looking good.
How many procedures are you doing a day or a week, do you think?
Anywhere between 8 to 10 procedures a day, in a week. If you're the only one doing them, you could do about I would say anywhere between 50 in a good week. Yeah.
Is it just you one-on-one with the attending?
Yeah. So a lot of times it's just me with the attendings. And I get to do most of it. Yeah.
Very cool. Anything you want to tell the applicants?
Yeah. So I kind of had an inside track. I did my surgical internship here at Yale, and so I kind of knew what I was getting myself into. 2 recommendations that I would make is figure out how the program retains their trainees, and if it's pretty high, that's probably a good sign. And then 2, look where they go after training here. You want to see them doing a wide variety of stuff, and being able to do that I think is really important too. So,
Cool. Thanks for your time.
yeah. All right.
All right, now we'll go speak with Kyle. I think just finished up that biopsy from earlier. And looks like here he is with Dr. Well, coming in. Hello. I'll close down patient information.
Yes,
This is
please.
Kyle. This is one of our new attendings, Dr. Shi.
Hi. Welcome, everyone. Very excited to
Hello.
meet you all.
Yeah, is there anything you want to tell the applicants?
We've been doing all day.
I'm doing a mammo mini fellowship, so I'm doing a body interventional fellowship, but I'd like to read mammo in private practice. And so today, I've been doing diagnostic mammograms and ultrasounds, and we ran into a patient with an abscess, so I just finished draining that. And in between those, I've been reading screening mammograms. I've read about 40 of those today so far.
That's pretty good.
Yeah, only new.
Yeah, lots of teaching that happens.
Yes.
Courtesy of
And
Dr.
would you
Shi.
say that I'm your favorite?
100%.
And hopefully you guys are interested in breast imaging. If you're on rotation with me at any point, I will convince you to do breast imaging. Hence, that's why he loves us so much.
Exactly.
Dr. Shi, you're new to Yale. Anything
I am,
that
I
attracted
am.
you to us specifically?
The residents. I heard they were super cool
Well, there you go.
and super smart.
We are really cool and very
Yeah,
smart.
Really, pretty awesome. But I think it's nice because it's a really large department. And so if you come residency here, you guys have lots of people you can become friends with, lots of people who you can work with. I heard the attendings are really nice. I actually haven't met many of them, so that's all I can say. That's COVID times. But yeah, I hope you guys have a great time. I hope you really pick Yale. Yale's fantastic. And I'm happy to be here. Hopefully we'll meet you guys.
Agree with
Thank
that.
you very much.
Yeah.
We'll leave you guys to it.
Sounds good?
Okay. All right, so now we'll go next door to the procedure room. So have who's here. We have Penny again. This is Leva, one of our other attendings. She's also on the selection committee. Anything you want to tell us about how you got to Yale or background?
Sure, absolutely. My name is Leva Andreeva. I'm an associate professor at Yale. I've been here since 2005, if you don't count undergrad, which was back in 92 to 96. But so I came here to do my fellowship, and then I stayed because I really think it's a great place to work. I think we do really good patient care, and I love working with the residents. We have a great residency program. We also have a fellowship, of course. But I love having residents on breast service. We keep them very busy. All residents rotate through diagnostic and screening mammography, which we do a lot of. We have a significant high-risk population. We have a high-risk clinic, so patients who are at elevated risk for breast cancer. So we do a large amount of breast MR, which residents are involved in from their first rotation. And they also get involved in biopsies during their first rotation. I expect the residents to be able to perform biopsies by the time they graduate. So initially, of course, we ease them in. I do a workshop with them to make sure they know how to use the devices, and we do a lot of teaching and make sure people get comfortable. So hopefully, by the time residents graduate, they can obviously do needle localizations. But I also ideally like them to be able to do pretty advanced biopsies. Many of our faculty are engaged in research, and residents are encouraged to pursue projects. There's plenty of projects involved. There are plenty of projects that are available in breast imaging that if residents are interested. So yes, and our facility was one of the first to actually both do tomosynthesis and also screening ultrasound. So many of the projects that are being done here are tied to either screening ultrasound or tomosynthesis. So we do a lot of research about that, and many of our residents have actually published seminal papers on these topics. So it's definitely an opportunity to get involved in some really interesting cutting-edge research.
Thank you.
You're welcome.
Bye, guys.
See you, Hetty.
Hey guys, Hetty again, one of the chiefs. So just wanted to give you a little rundown of what my month has been like on mammo. So we go through a lot of different rotations on mammo. One of them is a week of biopsies, which I'm on. It's great. This is actually one of the biopsy rooms where we do ultrasound. So patients come in here, We use the machine, and we have a variety of different biopsy devices. So you get to learn on everything, different techniques from different attendings from other different world-class institutions come here and they impart their knowledge on us. So it's really great. Another rotation on mammo is the Diag Rotation, where it's you and an attending one-on-one, no fellow in between. Patients come in for diagnostic imaging, you go in and you scan the patients yourself. Without the tech. The tech's there to help you and the attending there to help you, but you're doing a lot of the scanning yourself and problem solving. We also have a bunch of other sites that are outpatient, that are more community screening, also diagnostics, also some biopsies going on. We go to Divine, where again, it's just one-on-one with the attending, no fellow in the way. You have your own workstation, you have your own setup for mammo, your own device for mammo, so everything is really geared towards education. That's pretty much the 3 rotations that we do. We also, you guys heard from Casey, we do the MR rotation. I was on that also alone. Junior residents will be on that also alone. So you get a lot of exposure to MR, reading anywhere from 3 to 12 MRs a day. If you're not reading MRs, you're reading other outside studies. You're going over them with the attending. You're learning how to put them in the computer and in the system and what to look for. We also have Tumor Board, which residents also run at times, fellows run at times. The attendings are really there, they coach you through. It's not like you're just there by yourself, an attending is assigned to you and they walk you through the cases. You go over them before you do the Tumor Board, and we give our conversation and our thoughts and ideas to the pathologists, the breast surgeons, and the oncologists. So it's a very involved rotation. It's very patient-centered. They've done a really great job here of making sure that that's the case. And it's very positive for the residents and the trainees. So I hope that was helpful. All right, guys. Yeah, that's the mammo section. That's how the rotation runs here. And over the next couple of weeks, we'll go over the other sections and rotations. You'll meet the residents, meet the fellows, meet the faculty, and we'll go from there. Hope to see everyone soon.